Many patients that come in for a tummy tuck will ask whether they need to lose weight before they have surgery. And there's an actual way that we can advise and counsel our patients on what they might need to do before the tummy tuck. And so what we like to do is to get a BMI, or a ratio of the height and weight, to see if the patients are going to have a successful surgery and if it's going to be safe. And so this is actually a BMI chart that I use in my operating room. And so what we can do is actually plug in your height and weight either to a BMI calculator from an app that you can find on the internet, or a BMI calculator or chart that you can just find Googling on the internet. And from there we can determine whether your weight is appropriate for a tummy tuck. And what we actually like to do is have people's BMIs below 30. And so what that means is, I can give you a few examples. Someone who's 5'5" needs to be 180 pounds or less. Someone who's 5'2" needs to be about 170 pounds and less. Someone who's 5 foot probably needs to be 165 pounds or less to reach a BMI of less than 30. Because what we know from our studies is that when you have a BMI that's greater than 30, your risks after a tummy tuck surgery go up. Risks of wound problems, infection, fluid buildup. If people have a BMI of 40, then we really can't do that surgery. And sometimes with those patients, we're either giving them a consult to go talk to a bariatric surgeon about a gastric bypass or stomach stapling surgery, or we're sending them to get some real serious medical dieting and counseling so that they can get their BMI to 30. So what you need to keep in mind is that tummy tucks are not a weight reduction surgery. You might lose 5 to 10 pounds during a tummy tuck, but tummy tucks are usually a body contour surgery where we're trying to get your body to look close to what you looked like before you had children or experienced a large weight gain. So we want to make that surgery, which is an elective surgery, as safe as possible. So we want to get your BMI to less than 30. So if a patient comes into my office and their BMI is actually greater than 30, I can look at the chart and advise them to lose a little bit of weight. So if a 5'5" patient comes in and weighs 185 pounds, I can advise her to lose 5 to 6 pounds so we can get to a BMI of 30 or less, and then our operation is going to be safe and successful.